Welcome to Credentially's podcast, your HR healthcare kit.
Hi, everyone. It's me, Kit. I'm here on the Credentially podcast with a very special guest, someone that I spoke to and I thought had a really powerful story. Today, we're talking with Genevieve Schofield, someone with 18 years experience in healthcare, in HR, in recruitment, and someone that's really understood this problem that we're all trying to solve about how do you efficiently get people into an organization from many different perspectives. And so we had a great chat that unfortunately we did not record. And now I'm sort of going back and correcting that error. So Genevieve, when we spoke, you talked a lot about how you'd gotten started and your journey. And if I'm honest, I found it profoundly moving. So I'd love for you to just sort of say to our audience, kind of in your own words, sort of how you got to where you are now and what it is that you're looking to do.
Okay. First, thank you so much for having me. I'm really super excited to be here with you this morning. So a little bit of background about me. So I have 18 years in the medical staff credentialing field, and I started with a job that I applied in the newspaper, back whenever we still were doing that. And they asked me, was I interested in credentialing physicians for their military contracts? And I was like, yeah, great. I just need a job. And so I was blessed to have someone who was really invested in my success and trained me thoroughly. And I just really fell in love with all things that have to do with credentialing, physicians. And so I kept that momentum going. And so then I worked for the Department of Defense, the Department of the Army, Veterans Affairs, a couple of small hospitals. And then in 2018, I decided that, I could do this on my own. Like I'm doing this, but I know that there's more out there for me. And so I created, I got a tax ID number. I came up with my business name. And then I lost momentum. And I started working for a staffing agency that allowed me to travel, do like temporary assignments. And then in October of 2021, my oldest daughter, Allison, who was 26 at the time, passed away from a fentanyl poisoning. And when that happened, my everything just crashed. It was like, one day the world was full of color, and then the next day it was completely gray. And I was really searching and trying to figure out, like, how can I best honor Allison? And I just was thinking about what are the things that she was really great at. And I'll tell you, she had an entrepreneurial mindset, and she would champion anyone. She would find the best thing in you, and just totally rock that with you and encourage you. And I could just hear her saying to me, like, Mom, you got to do something with this business. And so I moved forward and I created my LLC and put myself out there on the internet. And really, I think by the grace of God and my daughter, I wound up getting these referrals from the staffing agency that I had been working at that they couldn't help. And so now I find myself with a handful of teleradiology clients. And so what I do for them is I apply for their state licenses. I manage the entire process, and then we track the licenses, afterwards. I also do some practice management and just some consulting on new graduates and in what directions they want to go, looking at contracts, making sure that those contracts are, they're getting the biggest bang for their buck. They're getting what they're, deserved. So yeah, that was my motivation for this. And when it gets hard and I'm feeling like, oh my God, this is so much work to have your own business, I just remember Allison's spirit and her drive, just for like life and for other people. And it just keeps me going.
It's such a profound story. And firstly, I'm so sorry. It's a terrible tragedy, and I'm filled with admiration, really, that you've been able to turn something, so tragic and such a terrible loss into something that's meaningful and that's really helping people and doing something that badly needs doing and doing well. And it sounds like this hasn't sort of been a static journey for you since then. It sounds like there's been sort of a period of quite exciting growth, and you're sort of considering taking on other people to help kind of service the demand for this. So it's clearly something that's going well. And how does that feel, sort of being on the other side of this, seeing something that was sort of at first frightening and daunting, I suppose, as starting a new business always is, and now is sort of a bit of a runaway success?
It feels surreal, to be honest with you. It when I started having more work than I could do on my own, it really blew my mind. Like, I'm not I don't advertise. My website is not really all that great. I don't have online traffic as most businesses do, and that's how they generate their leads. So I feel really super grateful, really blessed that these opportunities just keep landing in my lap. And now I have to find other people. I have to staff this business, which honestly, when I started it, I didn't think that far ahead. I just figured, it's gonna be good, but it's gonna be just enough work that I'll be able to handle it.
Yeah.
And so just super grateful for growth and opportunity to be able to help take some of the weight off of these providers that are, it's a struggle if you're trying to get licensed in all 50 states.
Yeah,
it's a lot.
Yeah.
So to be able to take that off their plate, I'm really happy about that.
Well, that's fantastic. And I think, you're saying sort of you've not done a lot of kind of web marketing or sort of digital promotion, but what that says to me is that all of this has come through word of mouth, right? Which is sort of the one thing that can't be purchased, and
Right.
Is a really great source of traffic and of leads and of people that know that they can trust you because someone that they trust trusts you, and that obviously speaks to the quality of the service you provide. So I'd love to sort of congratulate you on that, because it's very hard to do.
Thank you so much. Thank you. Really, like I said, I'm just blown away. Like, every day, I'm just like, wow, this is incredible. This is great. And then I run into opportunities like people with like you, like out of nowhere, there you were, and I was like, wow, oh my gosh, she's in another country. Holy cow.
Yeah, it's funny how things line up sometimes. I wanted to talk to you a little bit about how you go about solving this problem, right? So to get a clinician ready for one of your end clients, to ensure that someone's safe to practice in front of a patient. In the UK, there's sort of typically 20 to 30 pieces of evidence that need to be checked.
Wow.
And a lot of stuff that needs to happen in the background around that. So sort of, do they have the license to practice in that specialty? Do they have the right to work in the United Kingdom? And, in the US, you've got all of that. Plus, you have sort of the state and the federal system and all of those sort of jurisdictions, particularly for remote clinical advice or for sort of teleradiology or people that are providing advice in one state to a patient that maybe is in another state. And I want to talk to you just a little bit about how you'd kind of gone about solving that problem, because from what I understand, it had been a fairly heroic sort of, but very manual process. And I'd love to hear about how that was working.
So I would say that the biggest asset that I've found is software, credentialing software that provides automation.
Yeah.
So we're talking about automation for an NPDB, for
Mm.
your OIG, your EPLS, your peer references, background checks,
Mm.
and then the follow-up
Yeah.
on sending out the work and verifications, hospital affiliation verifications. Most of these things can be done online.
Yeah.
But having a system that automatically, as soon as you import the app, it starts ticking, checking off the ticks.
Yeah.
And so that really cut the work down, I would say probably by 25%.
Wow.
Yeah, definitely. So yeah, I would say automation.
Yeah.
Automation, most definitely. Now, of course, there's some things that you still have to do manually.
Mm.
Like, yes, you can do license verifications automatically, but the problem that I have with that is that sometimes they don't get flagged. And if you
Right.
have a practitioner who's had like a revocation of a license from a state and it has not yet been reported to the NPDB,
Mm.
it won't pop up on that automation. All you'll get is a verification of dates, right? Of issuance, of expiration. It doesn't flag board actions. And so that can be dangerous
Yeah.
if you're just solely relying on the software to do it all for you.
That's interesting because of that latency, I suppose, between the software that's aggregating all of that state information, maybe picking up that a board's taken that action, and the date with which it happened. There's a risk, I suppose, ultimately to the end client of yours or to the patient if someone's had some kind of change to their license or been censored in some way, and so potentially there's that risk there if you're trying to automate everything and the data is not sort of current.
Absolutely. I mean, as a medical staff professional, which is like the field that I fall into, we are the the gatekeepers for patient safety.
Yeah.
Right. So if we are negligent in our credentialing, ultimately the patient's going to be the one that pays the price. Yes, the facility is going to take a hit, probably financially, but it's definitely the patient. And so I just keep that in the forefront of my mind, constantly looking for red flags. If you find red flags, let the powers that be know right away so that they can make an educated decision on, if this is a risk that we want to take moving forward. So patient safety is really important to me. Finding good practitioners to provide the care for our patients is becoming increasingly harder to do.
Yeah.
I won't speculate on why that is, but to find a provider who doesn't have some type of malpractice hit or a hit on their license or a bad reference, you have to dig a little bit deeper.
Wow. That's interesting. And I think, given everything that's happened in the last couple of years, the strain that everyone in healthcare, both sort of clinical and non-clinical, has been under has been fairly tremendous. So it's perhaps not surprising to hear that it's getting harder to find people that have either unblemished records or that are looking for work that can be safely placed. What we've found in every country where we've spoken to professionals like yourself is that the labor market in healthcare has gotten incredibly tight. There's always been a bit of a gap between the number of clinicians we need and the number that we have, but that gap has widened so dramatically in the last 2 years. And the competition to hire those people has become quite intense. And they have a lot of options now with the sort of proliferation of telemedicine services, on-demand services that previously wasn't there. So how have you found that change in dynamic? Have you found that employers have to be doing things differently now, that it's harder to hire healthcare professionals? And what have you seen work well or not work?
So what I would say is that there's always been locums. Locum tenens have been a thing for I don't know how many years. But I've never seen locums used in the volume that I'm seeing now, because we had this mass exodus of healthcare providers during COVID, and so now you have all of these slots in these really critical specialized clinics that you can't find a provider who wants to be employed anymore. They all want to be locums, and for
Yeah.
many reasons, right? Flexibility in schedule, like double the amount of pay. You get to travel. So I would say what I found in that is this increased difficulty in finding capable safe providers when using this locums pool. What is the solution to that? I don't know. I think that COVID really put a really hard what would I say? A kick. It really gave healthcare providers a real kick, like kind of like a wake up call, right? Like we don't have to settle for this anymore. And, I should be more valued than I am. And that train of thinking, which is not wrong. But in the end, it also winds up costing the facility that's bringing on these providers ridiculous amounts of money, which is not sustainable. So there has to be a better solution than this. I don't know what it is, except be more aggressive with recruiting, do better with your screening, give larger bonuses, widen your net to new graduates. Those are the things that I can think of. But right now, it really is a locums world, and you can probably get pretty much just whatever you want, because there is a desperation.
It's interesting. We have obviously very different systems in the UK and in the US in terms of how care is paid for and the structure of our health systems. But we've seen a similar dynamic, particularly in primary care, where there's fewer and fewer physicians that want to work, what we would call them general practitioners, but sort of family physicians that want to have a stake in a practice and work full time. And there's more and more, in fact, the expectation is that you will work part time or as a locum, or not then be burdened by that responsibility of also managing what is effectively a small business. And that's been a dramatic change since I graduated from medical school. And I think it's something that's been accelerated by COVID. The other thing that we hear a lot is, particularly in nursing in the United States, the move towards travel nursing. So people or facilities knowing that if they have a rota that's unsafe, they might have to close a unit, and that's a disaster. And so if they can poach a nurse, or if they can find a nurse that's in perhaps an adjacent state and fly them in just to cover some shifts where otherwise they might have to close a facility, they're prepared to pay to do that, and sometimes pay quite above the norm. And so from all of the providers we've spoken to, we found that to be an interesting change kind of in the dynamic, and one that is perhaps slowing down, but doesn't seem to be reversing. And I'm interested to kind of hear your thoughts on that, kind of the change in the nature of work in healthcare.
Yeah, so that's interesting, because what I've seen in the US is that you're right, there's a huge influx of travel nurses. And so the travel nurses, I would say they probably make double what their employed counterparts make. And now that COVID has died down, nurses that are employed are leaving these employed positions to effectively be travel nurses, because it provides more stability for themselves and for their family. Again, being able to have more say so in your schedules. You get to, you've always wanted to go to Florida. Well, guess what? You can go to Florida for 2 weeks and work there, and then go somewhere else. So we have seen droves of nurses leaving these employed positions and taking to the travel nurse. There's been a lot of discussion about that on social media. Nurses being very frustrated that travel nurses come in and are working beside them and doing the same work, if not maybe sometimes less, but yet they're not being compensated. And the compensation that they get is like a pizza party, like, ooh, yay, we get a pizza party. That doesn't work with adults, maybe children. Can you imagine?
I mean, don't get me wrong, I'd love a pizza party, but no, it doesn't sort of structurally account for someone being paid to do the same work twice as much as you are, and being able to pick their hours and have a lot of the flexibility and freedom that I think for a lot of healthcare workers, the norm has been, certainly in the UK, you go where you're bidden to a degree, and you go and you work the hours that your employer says that you have to work. And certainly whilst you're in training, which is often very long, as you kind of begin and then undertake a medical career, you don't have a large degree of agency or autonomy. And I've had lots of friends and very talented doctors drop out of training positions purely so they can have that flexibility, because they had, say, a partner that lives in a different part of the United Kingdom. They wanted to be able to move and live with them, not unreasonably, but weren't able to do that with their sort of nationally given training post. And I think redressing that balance and not treating healthcare workers as kind of fungible labor tokens, people that can just be thrown at a problem, maybe needs to happen. But equally, at the end of the day, we all do this to treat patients and to make sure that when somebody's sick and in pain, that someone will be there to, look after them and treat them as best they can. And so I like you, I don't know what the ultimate answer is. I think we need to train, it would seem to me, we need to train more medical professionals than we're doing. We need to ensure that they're practicing at the top of their license wherever possible, so not wasting time on data entry and on things that they're not sort of specialists to do. But I'm keen to kind of just go back to something you were saying about automation and the tools that you've used. And last time when we chatted, I think you were able to kind of shed some light on what you'd seen to be sort of the good and the bad, and what works well and what works less well. And I'd love to kind of hear a little bit about that.
So I mean, as far as the automation goes, we talked about, the licensing automation and how you can miss vital information there. I would say that's probably the biggest downside, aside from, depending on, what your role and your function is, in the medical staff office or in your own business, reporting, being able to pull reports, without having to Google or YouTube how to do this, and not really getting, great step-by-step instructions, is very frustrating. It's super time consuming, and it needs to be better. I've yet to find software that does a really great job with reporting and making it simple, to where you could just check a box, that this is what you want. You want all practitioners that are expiring in the month of October to pull up, and it should take seconds to do this, not 10 or 15 minutes to figure out how to do it. So I would say those are probably the two downsides. I can't think of anything really better than a system that will do the knocking and the bugging of the peer reference for you, because whether you're doing payer enrollment or you're doing licensing or you're doing onboarding in the medical staff office, the one roadblock that always pops up as common is peer references.
Yeah.
For whatever reason, they're hard to get. People don't want to do them, or they've already done them. This provider's been credentialed at 10 different facilities. This reference has been used now 10 times, and they just don't want to do it anymore.
Yeah.
So not having to manually send out an email or pick up the phone and call them is fantastic. Same goes with the automation of the reports that are being pulled. Instead of having to go to each one of these government databases and log in and put in your payment information, it's all there for you really within minutes of importing an application.
Who has the time? And just your lovely dogs in the background, and some balloons as well.
Oh yeah, yes, I have balloons.
Looks like a very exciting work environment you've got.
Well, I try to keep it lively in here. I've got pictures of my daughter on the wall over here.
Oh.
I've got little Post-it notes that she had left me on my computer from the last time that she was here. Just, like, you're going to be
Oh, wow.
great today. And you're a boss ass bitch. You're a kick ass mom. Yeah. So I was having a bad day and she put those for me.
Oh,
I guess in September of last year. Yeah.
wow. Wow. What a nice thing to have and to be able
Yeah.
to look at as you kind of continue your journey. And I think that's a great place to leave it. And I've been very inspired by the journey that you've been on and what you've achieved. And I'm really looking forward to seeing if Credentially can help you at all in any way to continue with that success. I've really appreciated you taking the time to share the wealth of your experience. And I just want to say, Genevieve, from myself and our audience, how thankful I am. So thank you very much.
Well, thank you so much for having me and just, allowing me to share Allison with you because, there are really sad days. And then there are other days where I just want to make sure that she's not forgotten, that, that light that she had keeps shining. And so I really appreciate that. And to everybody that's listening, thank you for listening.
Well, Genevieve, thank you so much. I'm going to end this now. And again, from myself and the team at Credentially, thank you so much.
Search Credentially for your current healthcare staffing insights.